The Jim Rome Show, weekdays at 10. Sports Radio 610. The Sports Animal.
Back inside the Sports Bar, 610, The Sports Animal. Michael Carlisle, Mike Trujillo. All right, we'll get back to the phone calls, tweets, emails coming up in just a bit. Joining us now, as he does pretty much every week at this time, it's our good friend Michael Lubomov, GM over at Jackson Wink. Michael, how are you?
Hi, how you doing, guys? How's everything?
Doing very well. And you've got the good doctor with you as well?
Oh, yes. We have Dr. Bo Hightower over here, one of our leading doctors here at the team. We couldn't have done it without him. He's right here. He's going to say hello.
All right.
Hey,
Dr.
great to be with you guys today.
Yeah, man. Good to talk to you. So how does one become doctor to the stars, doctor to the athletes here in town?
Well, I think if you just do a good job and you stay with it and your name starts to get around pretty quick, and if you take care of people, usually these things take care of themselves. So I've been blessed to be able to work with these fighters and everybody else, and once they start doing better, they send their friends in, and we get more and more of those folks trusting us with their health.
I got to be honest, Dr. H, I'm a little intimidated with this interview. I don't think I've ever talked to anyone in the top 1% society. Mensa, dude, what the heck? How did you get so smart?
I don't know if it's a smart thing or somebody that just got really lucky at taking tests, but hey, I'll take it.
You've got, 3 Bachelor of Science degrees in biology from UNM, Bachelor of Science in Anatomy, Health and Wellness. Dude, you talk about putting your all into something.
Hey, exactly. Some people own houses. I just have a lot of letters after my name. So, you pick and choose, I guess.
Yeah. And for those who don't know, you also played football for the Lobos, right? You were a linebacker.
Yes, sir. I played for Rocky Long back in the early 2000s, some of those bowl teams. So it was a great experience.
Nice. Now, how did you wind up being a team doctor for Jackson Wink?
Well, long story short, I moved here about 3.5 years ago. I've had practices in Ohio and Texas and a few other places. We opened up our practice, and a couple of the fighters, Diego Sanchez in particular, Carlos Condit, started coming down, and they introduced me to Coach Winklejohn. So when he started to put together the plans for this new mega complex, it's basically the mecca for fighting gyms in the country. What they wanted to do was make it a very advanced place that had things that other gyms didn't have. So one of those would be a healthcare provider on site. So we went through, a couple interviews. He basically asked me questions, trying to see where I am philosophically. Coach Wink is a very straight shooter, and so he's checking to see, are you somebody that's going to mesh with our philosophy? And one thing led to another, and, from that day I've been able to help these guys get to the fights and do the things they like to do and the things they make money doing as well.
Dr. Hightower, Mike Trujillo here. Tell us everything that encompasses elite orthotherapy and sports medicine.
Yeah, so basically we're just taking the best practices of any kind of physical therapy, chiropractic. One of the techniques that we have is called naturopathic medicine. I actually teach at a naturopathic school in Santa Fe. So it's Southwest University of Naturopathic Medicine. And what they are, they're experts in connective tissue. So one of the things we're evaluating here on a day-to-day basis are overactive muscles and underactive muscles. So if we get somebody balanced, meaning we strengthen the muscles that are too weak, and we loosen up the muscles that are too tight, generally speaking, they're going to feel a lot better. There's bony alignments, we fix those too. And then we have to assess, obviously, for things that we can't necessarily fix so we can get them to the right person. So say fractures or dislocations or things like that. So, being that first line of defense really helps over-medicalizing some of these injuries. So people get pulled a lot of times when they don't necessarily need to, when it's not as bad as they think it is. But, getting that first line of defense allows us to tell them, is this something you need to go see a surgeon for? Is this something need to go, get antibiotics or whatever for? So if it's simple, we fix it. If it's more complicated, then we refer out. And it's been a great partnership so far.
We're talking with Dr. Bo Hightower, by far the smartest person to ever be on this show, and he is the team doctor over at Jackson Wink. Dr. H, for most regular people, you go to the doctor when you're sick, when you're hurt, when you're injured. When you're dealing with athletes and people who compete at a high level, how much does preventative maintenance go into dealing with athletes to keep them from becoming injured in the first place?
Right. So this is a conversation we have a lot of times in the office. We like to use a dental analogy. So think about the hygiene that you take care of, hopefully, right? Hopefully, for your teeth and your gums and everything like that. We're brushing and flossing, hint, twice a day. You're washing your skin. You're taking a shower, hopefully, again. It depends on who we're talking to, I suppose. But, essentially we're trying to get people to take a look at their muscular system in the same way. So, an ounce of prevention goes a long way. If you keep your muscles loose in the long term, again, 5 minutes in the morning, 5 minutes in the evening, whether it's stretching or foam rolling or, doing the right strengthening exercises to keep your body healthy, you're going to go a long way to avoiding disability, avoiding surgeries, and avoiding all kinds of other costly and damaging things down the road.
What's it like when you have to finally put the kibosh on an athlete and tell them, look, this is a condition that you're not going to be able to go on and either fight or play anymore? What's that conversation like, and how often does it happen? I mean, I'm guessing a lot.
Yeah, those are heartbreaking situations, and it actually doesn't happen too often, but when it does, they need the truth, and they need it to be straight to them. So there are certain injuries, particularly when you're talking MMA. These guys are really tough. These guys and gals, are really tough. There's certain things that they're going to fight through. This is the way they make a living. So, if they've got a rib issue that isn't enough that's going to sideline them, that's just pain, they need somebody to tell them, hey, listen, it's your tolerance to what you can train for. But the thing is if they don't show up and fight, they don't get paid. If my back hurts, I can still come to work, I can still do my thing. If you guys, say your shoulder's bugging you, that doesn't stop you from making a living. But with these athletes in particular, that can stop them from, feeding their kids, essentially. So we're going to do everything possible to help them do their job. Now, like you said, when the time comes, if you've got a torn ACL, if something's fractured, we had a young lady that kept breaking her hand over and over again, and she would come up, and I think she knew that it was, and she's crying, and, it's a real situation where to say, listen, you need to see a surgeon. If you don't get this handled now, it's going to make it a lot harder down the road. So, those are very, very emotional and difficult conversations to have, and obviously we hate to do it, but sometimes it's necessary.
Dr. Hightower, there's a lot of talk in sports in general these days, concussion symptoms, the long-term effects of suffering concussions. Obviously, in a high-impact sport like the world of MMA and boxing, that's something that's dealt with quite a bit. And what has changed, say, in the last 2, 3, 4 years as far as what people look for when it comes to concussions and treating people who have concussions and monitoring them and determining when they can resume practicing, sparring, and fighting?
Right. So the awareness has really changed the game a lot. People aren't having more concussions, even though they're being diagnosed with more. People are just more aware of concussions, and I think it's a good thing overall that we're taking preventative steps to assess people. Most high school teams have somebody on the sideline that has been trained in concussion protocols to be able to pull somebody out when we see those symptoms. Now, it's a tricky situation because, again, we don't really have enough hard information in the long-term studies. We know that CTE exists, and we know that some of the symptoms are physical. But there are some people, again, Frank Gifford, we've had some other folks that it seems like when they find another avenue down the road, we don't tend to see those same symptoms manifest as somebody that they have their whole life taken away. Like, say, an NFL player that's been the hero since he was 10 years old, and then he retires at 32. So you're not only dealing with physical trauma, but also, identity loss, identity crisis, and other things. So it's really multifactorial. So when we're talking about concussions, some of the things that have really changed, again, are people are putting in those evaluation protocols. They're taking away people's helmets, and you're seeing it in the NFL and college games. Yeah. And hopefully, we don't know if it will or it won't, but hopefully, we have the right intentions, and this will pay off down the line with somewhat less CTE.
One more thing I wanted to ask you about, and this probably is a little more MMA related as opposed to just sports in general, but a lot of talk in the last several months about weight cutting and changes being made to that. Obviously, a few weeks ago, Chris Cyborg went through a lot to make weight for her fight. What kind of potential damage is a fighter doing to themselves when they have to go to extreme measures to cut weight to make a fight?
Yeah, so there's a few things that can happen. Obviously, the most blatant one is going to be kidney damage and kidney stones. We've seen fighters have to go to the hospital because they've cut too much weight, and they basically dehydrate themselves to the point where their kidneys don't function properly. So when you're evaluating, we try to do a good job of helping folks out here, dropping good weight. So a gallon of water weighs about 9 pounds. Most fighters can generally manage a 10 to 15 pound weight cut okay. So if you come into fight week and you're 20 to 25 pounds over and you still have to make that weight, odds are you're having to dehydrate yourself to dangerous levels. And what we're seeing is people getting heat stroke because they're in the hot tub for too long. You're seeing people. The other big risk, again, is if your brain doesn't rehydrate or overhydrates after you put the water back in your system, you are at risk for more brain trauma and more of a concussion. So generally speaking, obviously nutrition and conditioning comes into it, but if you can get somebody within 10 pounds of their weight, usually they can fairly safely cut that weight. 10 pounds is not too much, depending on the size of the person. Obviously, if they're 105, it's a lot worse than someone who's 215 or 220. But there are some serious health risks to it, and I think that the fact that they moved the weigh-ins up a little earlier in the morning so that people don't have to go through that the whole day is a helpful measure. When you're talking about weight class sports, it's always a tricky situation because everybody's always going to try to game the system. So other than having them weigh in right before they go in the cage, the best thing we can do is try to keep things as safe as possible by giving them enough time to rehydrate and hopefully giving them some sort of nutritional and water-cutting guidance.
Is there more that could be done? Should the organizations look into more weight classes or anything like that? Or do you think that maybe this is something that gets talked about a little too much sometimes?
Yeah, you make a very valid point. Sometimes in these weight classes, like the women, for example, you have two weight classes. You have 135 and 115. Well, clearly women come in a lot different sizes than 135 and 115. Yeah. So when you're basically trying to force some of these larger women to cut down, and we saw that with Cyborg as well. So in a perfect world, yes, more weight classes certainly would be the best bet. In the men, you see a 155 and a 170 and then a 185. And those are pretty big differences there. So, if you're an ectomorph, a mesomorph, an endomorph, whatever morph you are, Mighty Morphin Power Rangers, it depends on kind of where you are on that. But, obviously a bigger, more muscular guy or gal is going to have a harder time making that. So in a perfect world, again, we would have more weight classes. Unfortunately, the companies that run that are in charge of making it a financially viable situation, and they call the shots.
Dr. Hightower, wish we had more time to talk with you. This has been utterly fascinating. Appreciate the time so much, man. Very informative stuff.
Hey, we totally appreciate you having us on. And, again, thanks to Michael Lubinoff and Jackson for continuing this program. I think it's a great thing for Albuquerque. I think it's a great thing for the gym.
Absolutely. And real quick, Michael, but before we let you go, I've gotten several messages over the last couple of weeks, people wanting to know how to access the online store, what hours they can go by over at the Academy to the gift shop there. Give everybody that info real quick.
Definitely, yes. You can go to jacksonwinkstore.com, and pretty much purchase everything that we sell in store downstairs as well. And then the store is open Monday through Friday, 10 a.m. to 2 p.m.
Gotcha.
So Monday through Friday, everyone's welcome, and we'd be happy to have you rocking our gear.
Perfect. But Michael, but appreciate it so much, man.
Anytime. We'll see you next week.
All right, take care. That's Michael Lubinoff and Dr. Bo Hightower.